Hello everyone, in this video we are going to discuss about rhinitis. So what is rhinitis? What is the definition of rhinitis? It is nothing but inflammation of the nasal mucosa. Rhinitis this class will be almost similar to conjunctivitis, which we have discussed in ophthalmology. Okay, conjunctivitis was inflammation of conjunctiva. Here rhinitis is the inflammation of nasal mucosa, and it is characterized by nasal obstruction, discharge, sneezing or itching. How do we classify rhinitis? Similar to conjunctivitis, rhinitis is again classified as infective rhinitis, allergic rhinitis, non-allergic or non-infective rhinitis, and atrophic rhinitis. So what is infective rhinitis? Again, it can be acute viral, acute bacterial or a chronic rhinitis. Acute viral is commonly caused by viruses like rhinovirus, adenovirus and coronavirus. Acute bacterial is caused by Streptococcus pneumoniae, H. influenza and Moraxella catarrhalis. Chronic rhinitis is caused secondary to sinusitis or a persistent infection. Allergic rhinitis, as we all know, it is most common non-infective cause, and it is seasonal because of hay fever or pollen grains, you can say. It is more common in summer seasons, and it can be perennial, like throughout the year. Non-allergic, non-infective rhinitis can be of several types like vasomotor rhinitis, occupational rhinitis, hormonal rhinitis or drug-induced rhinitis. So whatever the cause other than infective and allergic is there, we have put under non-allergic, non-infective rhinitis. What is atrophic rhinitis? Here primary is unknown, like the cause for the primary atrophic rhinitis is unknown, while cause for secondary atrophic rhinitis is mostly due to post-surgery trauma or infection. Okay, we'll start with etiology of the rhinitis. Just like we discussed, it can be infective. Viral is most common than bacterial, that is rhinoviral rhinitis is most common than bacterial rhinitis. Allergic, as we all know, it is a type 1 hypersensitivity reaction, and it is a reaction to environmental allergens like pollen, dust mites or animal danders, things like this. Non-allergic, non-infective rhinitis, again because of autonomic imbalance or endocrine factors or irritants. Atrophic rhinitis is mainly due to chronic inflammation that leads to atrophy of the nasal mucosa and glands. So here we can see the difference between allergic rhinitis and acute sinusitis. Okay, allergic rhinitis, almost the contents are always clear. In the frontal sinus, the contents are clear. In the ethmoid sinus also contents are clear. Middle meatus also contents are clear. There will be nasal obstruction, but clear watery discharge will be there in case of allergic rhinitis. Whereas in case of acute sinusitis, it will be, the discharge will be inflamed and purulent. So pus filled discharge will be there. That is the major difference. And nasal obstruction is common to both. Whereas if there is a purulent discharge, it is acute sinusitis. If the discharge is clear, it is allergic rhinitis. This is an image showing atrophic rhinitis. So here there is atrophy of the turbinates of the nose, because of which the nasal cavity has become roomy. Okay, so this is a characteristic finding in case of atrophic rhinitis, that is turbinate atrophy and roomy nasal cavity. So this is a characteristic feature of atrophic rhinitis. Coming to pathophysiology, what exactly happens in case of rhinitis? Suppose allergic rhinitis we are discussing. So as we all know, in case of summer season or somewhere, there will be allergen exposure to the body, in response to which our body will produce IgE mediated or Ig antibody, which will go and in turn degenerate the mast cells. Because of this mast cell degranulation, histamine which is stored in the mast cells will be released in large amounts, and this histamine, as we all know, it will go and bring about vasodilation, edema and mucus hypersecretion. So this histamine mediated response is the one which brings about all the symptoms of rhinitis. In case of infective rhinitis, pathogen will be there, maybe viral or bacterial. Viral is most common, so virus will come and it will replicate in our body, because of which there will be local inflammation, and in turn this will lead to increased vascular supply and mucus production. Ultimately, we are having more blood supply and mucus in the nasal cavity, and that is rhinitis. In case of atrophic rhinitis, there will be glandular atrophy and squamous metaplasia. Okay, because of this reason, there will be crusting and foul smell along with inferior turbinate or nasal turbinate hypertrophy or atrophy and roomy nasal cavity. Crusting and foul smell will be characteristic in case of atrophic rhinitis. What are the clinical features of rhinitis? Generally, the symptoms include nasal obstruction, nasal discharge. Again, it can vary. It may be clear or it may be purulent. Like clear in case of allergic rhinitis, purulent in case of acute sinusitis. Other clinical features include sneezing, itching, anosmia, that is absent smell sensation. Sense of smell is absent and that is called as anosmia. Again, discussing signs by type of rhinitis. If it is an acute viral rhinitis, usually the discharge will be watery and then it might convert into mucoid inconsistency. What are the other features usually? Like as we all experience in other viral causes, it can be malaise, fatigue, low grade fever kind of thing. In case of acute bacterial rhinitis, the discharge is purulent and other features include facial pain and tenderness because it will lead to sinusitis. So sinus pain might be expressed as facial pain and tenderness. In case of allergic rhinitis, discharge is watery and clear. Other than that, allergic salute, nasal crease and denim organ lines can be seen on the nose. So these are the features of allergic rhinitis. So over the nose, if this is a nose, there will be a characteristic skin crease which is almost like hyperpigmented over the nose because of continuous discharge from the nose. The person will be trying to avoid it. So he will be using his hand to control it and that is called as allergic salute. And after certain time there will be this hyperpigmented line appearing over the nose and this is called as denim organs line. Okay. Next, in vasomotor rhinitis, the discharge is again watery and it is triggered by temperature or odor. This is basically autonomic imbalance. Because of some reason, because of certain odor or due to certain temperature, our autonomic nervous system, that is sympathetic and parasympathetic system, that will get activated or that there will be imbalance in them and that will lead to increased nasal secretions and that is watery in consistency. Other than that, atrophic rhinitis, again just like we discussed, there will be crushed, foul smell and roomy nasal cavity. Along with that, nasal turbinates atrophy will be there and the mucosa will be pale. So these are the signs by type of rhinitis and clinical features of rhinitis. Again, just going through the pictorial representation of symptoms of rhinitis. Persistent sneezing will be there, which is frequent and uncontrollable. Sneezing spells will be triggered by nasal irritation and these are a hallmark for rhinitis. Other than persistent sneezing, nasal congestion will be there. It is like stuffy nose, feeling congested or stuffy due to swollen nasal passages and it is a common symptom often worsened by environmental triggers. Runny nose is a other common symptom, experiencing a constant flow of clear nasal discharge, particularly in response to allergens. Okay. Next, itchy nose, eyes or throat. Because of persistent release of histamine, there will be systemic symptoms like nose, eyes and throat. Everywhere there will be symptoms of itching. This is characteristic of allergic rhinitis. Other than that, watery eyes. Rhinitis can affect the eyes, causing redness, itching and excessive tearing and that is represented as watery eyes. Reduced sense of smell or that is temporary or permanent sense of smell loss called as anosmia might be present and rhinitis can diminish one's that is ability to smell, hence it will affect taste and overall quality of life also. So this was about symptoms of rhinitis. Now how do we come to the diagnosis of rhinitis? It is usually clinical. Once the patient presents to the clinic, we can just see and diagnose rhinitis. Other than that, what are the possible investigations we can do? We can take a nasal smear and look for eosinophils in case of allergic and neutrophils will be present in case of bacterial rhinitis. Skin prick test can be done. This is basically for allergic rhinitis, and we can also do serum Ig levels assay to come to the diagnosis of allergic rhinitis. Other than that, nasal endoscopy can be done. Again, this can be done for atrophic rhinitis to see if the turbinates atrophy is there, or if there is a roomy nasal cavity, or if there is any inflammation, hyperemia, congestion. All these things can be noted down. Culture and sensitivity can be done if bacterial rhinitis is suspected, so that we can choose appropriate antibiotic of choice. What is the treatment for rhinitis? Generally, the treatment is, for example, if it is allergic rhinitis, avoiding the allergen is the first treatment. Other than that, we can suggest steam inhalation or proper hydration for certain duration. Other than that, we can also prescribe saline nasal irrigation so that the congestion will be relieved. In case of acute viral rhinitis, symptomatic management, again, like if there is a congestion, if there is a stuffy nose, to relieve that, we'll give decongestants like xylometazoline, oxametazolline, all these drops. Okay. Other than that, we can also prescribe antihistamines to reduce the irritation and itching, like cetirizine. Then paracetamol, etc. can be prescribed based on, since it is a viral, there may be a viral fever. To reduce that viral fever, we can prescribe paracetamol. In case of acute bacterial rhinitis, we will prescribe antibiotics. Again, most commonly we will prescribe amoxiclav, that is amoxicillin and clavulinate. But again, if you send for culture and sensitivity, you can choose appropriate antibiotic based on the bacteria to which it is sensitive. Other than that, painkillers like analgesics and decongestants can be used. In case of allergic rhinitis, antihistamines, because it is mainly due to mast cell degranulation, which has released a lot of histamine. So antihistamines like cetirizine or loratadine is used. Intranasal steroids can be given in too much severe cases like fluticasone or mometazone, where there is recurrence of allergic rhinitis. So in that cases, we can prescribe intranasal steroids because these will suppress the immune system. And then leukotriene receptor antagonists, these are being used widely nowadays, that is montelukast. So most common prescription will do nowadays is Montec LC, which contains montelukast and levocetirizine. Okay, so this montelukast is a leukotriene receptor antagonist, so that will in turn prevent histamine secretion again, so thereby controlling all the symptoms. Other than that, again, immunotherapy is selected in certain cases since it is an allergic cause. In case of vasomotor rhinitis, we should, as we discussed, there is some certain temperature or certain odor that will trigger clear watery discharge from the nose. So we will have to identify that trigger, like which particular odor or which particular temperature, and then avoid those triggers. Or we can also give topical antihistamines or intranasal steroids in case of vasomotor rhinitis. For atrophic rhinitis, again, there will be foul smelling and crusting, and to avoid crusting and to get rid of crusting, we can do nasal dousing with alkaline solutions. Local antibiotic ointments can be given for preventing secondary infections. If there is a secondary infection, again prescribe these. Then surgical options, it's called as Young's operation or submucosal injections can be given. So atrophic rhinitis is one of the important type of rhinitis which should be looked for, because it might become a bit more serious and it might require a surgical intervention. What are the complications of rhinitis if not treated? It can lead to sinusitis. I mean, if there is a nasal mucosal inflammation and if it is not treated, then it will lead to infection, and that will in turn lead to sinusitis. Other than that, otitis media can happen because we all know from nose to ear there is a connection, that is eustachian tube. So there can be otitis media. Nasal polyps can occur. Secondary bacterial infection might occur if not treated, and epistaxis might occur because of atrophic rhinitis. How do we prevent all this? Prevention is mainly for allergic rhinitis, control allergens. For other causes like bacterial infection and all, keep good nasal hygiene and avoid overuse of nasal decongestants. So in summary, what all we studied under rhinitis? So basically the symptoms: sneezing, lacrimation, watery eyes, nose smell, that is anosmia, nasal discharge, nasal congestion, and other ailments like fever. All these are the symptoms or clinical features with which the patient will come. On examination, rhinitis if we do a nasal endoscopy, there will be inflammation of the mucosa or congestion or hyperemia, so and so. What are the causes actually? It can be viral, most commonly rhinovirus, and then adenovirus, or bacterial like streptococcal pneumonia, or it can be due to allergens like heavy dirty air or dust air, or because of pollen. It can be vasomotor, in case of vasomotor rhinitis, it can be due to temperature, that is hypothermia. After this, how do we treat these patients? Usually for general causes we can advise steam inhalation, saline nasal sprays, anti-inflammatory pills, or antibiotic for bacterial rhinitis, or antiviral drugs in certain viral diseases. So this was about rhinitis.